Here's the deal. I want to address the blatant misconceptions around Medicaid and SNAP recipients because the comment section on some of my videos, even the one that I made about me 10 years ago with my daughters dancing in the kitchen, I was working. I was working 32 hours a week, 8-hour days, 4 days a week, because that was the way that the dental practice I worked at scheduled their front office employees. I was given $15 an hour. That was my starting salary, well above the minimum wage at the time. And that worked out to be just under $25,000 a year. Based on me being a single parent with 3 young children, I qualified for $650 a month in food and Medicaid, health care for my children, as well as a very bare bones basic plan for myself as a mom. Here's what you need to understand. I made $25,000 a year. Do you know what that works out to be a month? $2,080 a month. And this was pre-taxes. So before I paid my federal, my state, my Medicare, my Social Security. She took all that stuff out. I cleared about $1,900 a month. And initially, I was able to find a place to rent in my kids' school division for $900 a month, which was great. But over the course of the next 2 years, I had to find new residents, and I ended up renting for $1,100 a month. That was the cheapest I could find. So I had to pay utilities. I had to pay power. I had to pay water. I had to pay for my cell phone that I was using. I had to pay for internet at my house. I also had to pay for gas to go to and from work. I had to pay the woman that lived behind me to watch my children so that the 4 days a week I worked, there was somewhere for them to go off of the bus until I got home at 5:30, 6 o'clock at night. I had so many costs that I was barely breaking even month after month. I accrued credit card debt. There was a lot happening during that time frame that stressed me out. If I had an emergency for myself, I literally broke my leg during this time frame, like had to get all of this stuff. I didn't have coverage for that. That was money I had to pay in a payment plan. If my car broke down, which fun fact, it did, that was like a do or die moment. Oh my God, what am I going to do? I have to have a vehicle. The idea of having to get my oil changed or get a tire replaced was terrifying because I'm thinking to myself, how do I pay for it? This is the story of a majority of people that are getting Medicaid right now. My story is not unusual or uncommon at all. 64% of Medicaid recipients are employed. 44% are working full-time and 20% are working part-time. 12% of them are literally caregivers for dependents. That is their job, keeping a human alive. 10% are on it due to disability or severe illness. My friend's daughter is one of those individuals. 7% are not working because they're trying to acquire a higher education to get a better quality paying job so they don't have to be on these programs anymore. And then the other 7% are not working for reasons like retirement, inability to find work, or other unspecified reasons. Let's say we eliminate that 7% that's listed as not working. Now, and again, they have likely legitimate reasons for not and are applying and maintaining their health care. But let's say we did. Do you think that equals the nearly $900+ billion they just eliminated from the program come 2027? Fun fact, it doesn't. No, the intention behind the policy specifically changes that they're putting in here is that now, instead of the way I was getting it, where they just re-upped my plan when they saw my tax form submitted year over year and recognized I still income qualified, now you're going to force somebody to get a pay stub, which nobody gets pay stubs anymore. You're going to go seek it out on the internet or make a request from your employer. And then every 6 months, you have to go and probably take a day off because you have to go to the social service office Monday through Friday during their office hours and go in there and reapply and do all the paperwork and hope that you still qualify. Also, you can maintain your health insurance. They recognize that most people on these programs, like me, are just trying to make ends meet, are burning the candle from morning to night, getting their kids up and going to school, going to work, getting their kids home, feeding them, and trying to get them to bed. They are just surviving, and they're going to miss deadlines. They're going to forget about this. They're going to not even realize this is a new requirement, and they're going to lose their health care. That is where those cuts are coming from. That is how they're able to estimate such a high level of money coming out of Medicaid and roughly 17 million Americans losing it. It is not because Democrats are lying to you. It's because Democrats recognize the reality of the situation. I recognize, as someone who lived through it, the reality of the situation. There are countless people that live, especially in densely populated cities. They don't have cars. So now you're asking them to take time off, pay for an Uber or other forms of public transit, to go to a social service and wait in a long line and probably lose an entire day of work to reapply for something that could have easily been done automatically. This is about clogging up the system and creating an environment where people just lose health care And then we are watching healthcare facilities close, hospitals close, emergency wait times get larger and larger. You are not going to be unaffected from this policy. You can sit here and call me a fearmonger. You can sit here and say I'm lying, but I lived it. And that's why I'm running to represent my community, because I understand what it's like to be on the other side of that situation. And I'm going to fight like hell to make sure that people in Virginia and in my district have access to those benefits, because they saved my life and they are saving other members of my community's lives right now. Period. This is heartless behavior. And if you're one of those people calling these people lazy and saying, go to work, pull your bootstraps up, and you have a Bible verse in your profile, delete it immediately. Please and thank you.